who have sedentary lifestyle. Out of 10 million, 4.7 people runners will get a sudden cardiac arrest or a sudden cardiac death incidents, as compared to 50 to 100 out of 10 million incident in general population. So these events are less in people who are athletes, who are endurance athletes, but still we see a lot of incidences like these happening. So first of all, I will like to discuss, there are two types, two age category that we divided into. One is less than 35 years of age, which are young athletes, and one is more than 35 years of age, which we consider it as a master athlete or middle-aged athletes. So the causes of sudden cardiac arrest in younger population is because of some structural heart defects. Like some patients may have hypertrophic cardiomyopathy, in which the heart muscles are thick, and this is genetically transmitted in individuals, and we can detect this by doing pre-participation ECG and other non-invasive tests like echocardiography, and we can detect some of these diseases. And a basic test like a young athlete who is going to participate in an competitive event, or he's going to start his sports journey, he can just a small a brief family history, personal history, and also a simple test like ECG can give us a lot of clues, and those who are above 35 years of age, the common cause of sudden cardiac death in that is the blockages in the artery, which we call as a coronary artery disease, or so we need to actually see the profile of the patient, and accordingly we need to give them the advice, how to go about training. And also, as an organizer, what I feel is that to prevent, and there are 70% of the cases we can detect by taking a proper history, a family history, personal history, their symptoms, whether they feel anything like chest pain or heaviness when they are doing anything, or any breathlessness they feel, any excessive fatigueness they feel while doing any physical activity, all these symptoms. Also, family history is very important. Family history of sudden cardiac death in the first degree relative, the father, mother, or their siblings, that also can give us a very important clue that they are at a high risk, when they are involving in the high endurance sports activity. So all these things are very important, and in the older individuals, like those who are above 35 years of age, if they uh, uh, coronary artery disease is the most common cause, especially those who start their journey, those who are chronic smokers and have obesity, hypertension, diabetes as a risk factor, and they are going to modify their lifestyle, then I think they need a proper physician, a proper examination by their family physician, or pre-participation screening is required for them to before they get into the exercise model. And still, apart from doing all these things, there are 10 to 20% of the cases which we cannot predict. In spite of doing all the testing, they can still have a cardiac arrest. So in that case, there is very important role of having a proper medical setup at the holding area, and a proper medical team with cardiac ambulances on the route, and a proper medical setup which will include emergency, either emergency paramedics, emergency trained physicians who can handle external defibrillators, and can immediately, and they should be basic life support and advanced cardiac life support certified paramedics should be there at the holding area. And also those who are there with the ambulance, they should be they should there, because they'll be the first responders. So they should know how to do a proper CPR and how to, how to operate this AEDs, which can be lifesaver, I mean, that can save a person's life. And also we as a runners, there are so many running groups and which are like training all together. They can have the incidents while training also. So all these runners, all the coaches, they should be well versed with the basic, at least the basic life support. They should know how to do a proper CPR, how to maintain the airway. So this training can be easily done through any hospital, especially when you are organizing an event. You must be having a lot of volunteers. You can get a formal 2 hours training through the hospital, which is your medical partner. They can give them the training how to perform a CPR if they see someone lying unconscious on the road. And because the time is precious, first 3 to 4 minutes, if someone is unconscious, and if someone immediately start the CPR till the advanced cardiac ambulance arises, that can actually save the life of a human being.
Okay, sure. And doctor, the incidents that happen at the finish line, that a person finishes a half marathon and collapses in the next 5 minutes or whatever else. Do you think it is just incidental, or do you think that there is that
No,
person has a heart condition?
these type of death, we call it the sudden cardiac death due to sports activity.
Okay.
During the event or 1 hour after the event, these are all exercise induced cardiac deaths.
Okay, so there may have been a cardiac condition that the person didn't know.
Yes, they might be having a pre-existing cardiac disease, which might have got aggravated and would have led to cardiac arrest.
So is there any symptoms?
Because I don't think 80% of the population who is running is undergoing any sort of screening test or anything like that before starting their this training for marathons. And marathon is a very high endurance sport. And after finishing your studies have been seen that after you finish your full marathon, your heart get damaged, and there are cardiac markers which get elevated in the blood, which usually happen when there is a heart attack. And it takes at least 3 to 4 weeks for the heart to recover from the one race you do. And another problem what I feel is that people tend to get carried away. This running season is approaching. Every week, every month, there will be 3 to 4 events, and everyone wants to participate in all the events, want to give their personal best in all the events. Once they wear bib, they just get carried away. So that's a very wrong approach. They should actually, if they want to prepare for a race, they should choose one race which they want to do their personal best. Rest of the races, they should just do moderate intensity or very light run, just to be there in the event, but not to give a personal best in every event. And after full marathon, you need at least 3 weeks of break. Doesn't mean that you should be out of your training. You should be doing very light walk, jog of around, maintaining the mileage of around, say 10-20 kilometers in a week. Do some sort of cross training, yoga, stretching, all those things for 3 weeks. And give them some time. We should give our body some time to recover from
a full marathon,
from what we have done. Yeah.
And what about a half marathon? Do you think that the same kind of damage to
the risk of cardiac arrest in half marathon is less than the full marathon? Okay. But still risk is there.
Okay, but you need that kind of recovery, like if you said that it is about 3 weeks of recovery after a full marathon.
Yeah, at least in a half marathon, 1.5 to 2 weeks of recovery is required. Best is to monitor your basal heart rate. If your resting heart rate, whatever is your resting heart rate, after doing your full marathon or after doing your half marathon, if your resting heart rate, you have not achieved your resting heart rate, that means your heart is still not recovered.
Sure. All right. So I'm, whoever is on mute, if you've got any questions, I think Tagore has raised his hand. So Tagore, if you want to ask, please ask.
Yeah, thank you very much, ma'am. This is very helpful, and I've been waiting for this session. Thanks a lot for the Super Sick Run to organize such a great event. Great session with renowned doctor like Dr. Ramit. Sir, your explanation is self-explanatory. I have only one doubt, sir. In case guys, particularly guys or girls, those who are beyond 35, what are the precautions that we need to be cognizant now at least 3-4 days before the event? Maybe we are not aware of those symptoms. Knowingly, we may participate. What are the
First of
symptoms?
all, one thing we should make sure is that we should properly train for a half marathon or a marathon. Okay, a proper training is must, which you say for a full marathon, it will be somewhere between 18 to 20 weeks, and for a half marathon around say 8 to 12 weeks. And you should gradually build up your mileage, and you should increase it by 10%. I think your coaches must be helping you in doing that. Structured training is must. 5 to 6 days of running, at least 5 days of running in a week is required, in which in a half marathon you every day you cover around 5 to 8 kilometers, and during the weekend say you can do a long run more than 10 kilometer, and gradually 10% increase, gradual increase in the mileage, you can do it. Another thing is maintaining your hydration status. It is very important, because most of the time, when you are running a half marathon or a full marathon, you tend to get dehydrated. You lose a lot of salt, sodium, potassium, and these hypokalemia, hyponatremia, these can become a substrate to trigger dangerous rhythms like ventricular tachycardia or ventricular fibrillation, which can lead to sudden cardiac arrest. So it is very important that before the run you are properly hydrated, maintain your nutrition, stop if you are running and doing smoking or taking alcohol every day. Please stop that, because these bad lifestyle habits are not going to they will cause their harm in their own path, and running will not give you immunity from heart disease if we continue with the poor lifestyle. Another thing is sleep is very important. At least 7 hours sleep is very important for our body to recover. And also then there are many other factors, environmental factors, the stress which we have in our work and routine life. So all those things, you need to take into consideration while doing your this thing.
Can one overhydrate? Do you think one can also overhydrate? That could also cause any heart.
Yes, a lot of free water, even if you take 7-8 liters, that can also lead to delusional hyponatremia and all those things. We should not overhydrate. The best marker is your urine color. Once suppose your urine color is very yellow, that means your body is dehydrated. If it is just pale yellow or whitish, that means your body hydration status is good.
Sure, thanks.
And before running a race, every individual is different. Some have very high sweating rates, some perspire a lot, some they don't sweat that much. So according to your sweat rate, you should take your fluid intake. Best marker is like everyday training. When you are doing your training, suppose you are doing your 10 kilometer and you are doing at a moderate effort, then your pre-run weight and post-run weight, the deficit is the amount of fluid you have lost. So you have to replenish that immediately. And also while running in an hour or so, you have to at least take 500-600 ml of water if you are water or electrolytes, Energel or whatever you guys are using. So please continue taking that in a sips while doing your workout to keep your hydration status well maintained.
Sure. Okay. Thank you very much. Tagore, can I move on to the next
Yeah.
person who's raised a hand?
Yes, ma'am.
Priyambad, you could ask next, and whoever's raising hands, I'm just taking that order. Yeah, Priyambad.
Yeah, good evening. This is Priyambad. So my question is regarding the same for the resting heart rate.
Sorry?
The resting heart rate you mentioned after the so I've observed the resting heart rate is for the course of the day it falls.
Prem, your voice is breaking. It's not clear.
Can you type your question? I'll read it out.
Is it better?
No.
Hello?
No, it is not. Just
Okay,
type your question. Remember, type your question on the chat box. Type your question.
Yeah, in the meanwhile, can you ask the other question, madam? If someone else is here.
So Harmeet, you could ask next.
Sasrikal to everyone. Good PG, thank you for organizing this. Thank you for coming. It's really very nice of you that in such a short notice you have to spend 30 minutes that also on a weekend with us. While most of the serious runners on the call will agree to most of the things you've said, I have just one question for you, which is the symptom that sometimes I feel is setting in off about headache 3-4 hours after the run. Like when I sleep, do a recovery sleep, I get up with a headache or a warm head. So why does this happen? And what are the causes for it, and how do we really rectify this?
So the most common cause of headache after running is actually electrolyte imbalance. If you are not having adequate hydration, or you're dehydrated, that can lead to headache. Also, it also depends that if you are running in a very hot, humid condition and hyperthermia, that can also lead to headache after run. So try and maintain your hydration after finishing your run. Try to have at least 1 or 2 liters of water, or mix of water and electrolytes. That will help. And sometimes also when you are running in sun, try to use shades rather than that will also help you in reducing your headache.
Yes, Dr. Saab. So I run very early in the morning, so there is no question of sun.
Okay.
Hydration, I do understand, and the headache sets in late. It's not like it sets in immediately after the run. And it usually helps, let's say, for example, runs.
And also
So
you need
just did
to
about 5
just monitor.
kilometers or 10 kilometers of training. And after that,
Hello. And
yeah, and
also
then we,
any you have any history of hypertension, or your BP? Did you get your BP checked?
yes, in the family it is there.
It is there, but did you get your BP checked? Because sometimes I have seen few runners who are unaware of having hypertension, and when they came for a checkup to me for just a routine check, I found that the BP was more than the lower BP was more than 100 and the upper one was more than 150. They were totally unaware, and they were not having any symptoms. So just get yourself screened out for any hypertension, or that can also trigger this headache.
Thank you. So
Okay,
Priyamba,
doctor. Thank you.
thank you, Harmeet. But Priyamba's question is the resting heart rate below 60 during course of the day normal, particularly when doing strenuous?
Yes. So those who are athletes, they have a high vagal tone, and the lower the resting heart rate, the more healthy, the more conditioned their heart is. So even if their resting heart or sleeping heart rate goes below 40, there's nothing to worry about.
Right.
So
Jatinder,
those who are training hard and they are endurance athletes, their heart rate is remains on the lower side only, which is a good sign.
Yeah, it's exactly the same. It's almost below 40.
Yeah. Nothing to worry for that.
Thank you, Doctor.
Jatinder, you could ask your question.
Sasrikal to everyone.
Sat Sri Akal.
I recently shifted from Delhi to Kolkata, and it's a coastal area. So 2 years back, I used to do cycling daily. So recently, I have shifted to running. So one day I'm doing running, and one day I'm doing cycling. So what precaution shall I take in the coastal area?
So coastal area, normally they are more humid. So and temperature is bit on the higher side. So I think humidity and warm weather. So that was you need to take good care of your fluid status and hydration.
Okay.
And also it is very important that when you are running every day, when you are running, you should not run fast every day. You should not your run should be mix of low intensity, moderate intervals. And when you are doing low intensity, means you are running somewhere between 50 to 60% of your maximum heart rate. So once in a
Okay.
week or twice in a week, you can do like lactate threshold run, in which the heart rate can go somewhere between 160, and interval training, yes, it can go up till 90% of your maximum predicted heart rate. So just do mix of this thing, but every day you should not run at your maximum heart rate or some maximum effort.
Like one day I'm doing cycling and one day I'm doing running up to 5 kilometers only.
Okay. You can
Not more than that.
continue. Yeah, you can continue with that, and gradually, if you want to increase, gradually you can increase.
Okay, like whole of the year in Kolkata, there is a lot of humidity.
Yes. So you
So
need to take care of your your electrolytes. When you are doing running, it's always better that you carry a sipper with you. Put some electrolyte
okay.
solution into that. Your ORS,
Mhm.
Energel, whatever you're comfortable with, and keep sipping
Mhm.
it. 5 kilometers is not much distance, so I think 250 ml of water should be more than sufficient.
Okay.
So I
Okay,
think
thank you.
And maintain your hydration throughout the day. That's it.
I see
Okay,
that
thank
Gujal
you.
has left the chat. So next, I think Sanjay, you could ask your question next.
Yeah, hi, doctor. So I have a question related to resting heart rate. I know that lower the heart rate is better, but sometimes I don't know whether is it a point of worry or not, because during the sleep, it's dropping even 37, 38, even 36. And when I'm working in office, still it's keeping the heart rate keeps when I'm working on my laptop in my office or at home. It's always like sometimes it goes below 45, 40, 41, 42, 45.
So
Is there anything that I need to...
do you feel any symptoms when it is dropping below 40?
No symptoms.
Okay. And what's your age?
I'm 35.
35. So see, maximum what you can do is get a 24-hour Holter monitoring done. Okay. That's a 24-hour ECG monitoring. You can just get it done. It can be done anywhere in the hospital. So in that we can just rule out if there is any sort of heart block or anything happening during sleep or when you are working. If
Yeah,
that is
because
normal, if
during
there
the
is no
workout,
heart block or anything, I think there is nothing to worry.
okay, because when I because I'm more into cycling, so my heart rate always keep on a lower side when I'm riding. But when I'm running, it always on a little bit higher than the cycling. So it's like it
Yeah,
goes around 150,
see,
170.
this is normal phenomena because running involves a lot of muscles, and through your whole body is moving. So obviously the heart rate while running will be more than what you are doing in the cycling, unless and until you are doing hill intervals on your cycle, or doing high intensity power workout in your cycle. Your heart rate will not jump that much as compared to when you do it while running. So that is understandable.
So 24-hour ECG monitor that you are saying,
Yeah, that is called as the Holter monitoring.
Holter monitoring.
Yeah.
Okay. Thanks,
Thank you,
doctor.
Sanjay.
And sometimes, in Holter monitoring, even if you get a first degree AV block or a second degree type 1 AV block, that your physician will tell you, in athletes, no intervention is required for that. It can happen.
Okay.
Shubham, you could ask your next question.
Thank you, ma'am. Namaste, everyone. Thank you, sir. So I'll be running for the first time on 16th of October, and I have never run, and I do very less workout or gymming or something like any active physical activity. So what suggestions would you give? I have just started running. It's been 2 or 3 days. So what suggestions can you give for the first time I'll be going for this marathon on 16th?
And what's your age, Shubham?
26.
Sorry?
26.
26.
Yes.
So, and do you have any symptoms while, while doing any sort of physical activity, climbing stairs or anything?
No, but if I do it after quite a long time, then I do get a little headache, but not more than that. Not more than that. Otherwise,
So I
I'm
think
fine.
you should target, around 5 kilometer or less than that, and start with a run and walk.
Okay.
Do some 2 kilometer of jogging and then some walking. I think that's the way you can start, and weekly twice you can do some sort of strength training that will complement you in doing your runs.
Okay.
And if you feel any symptoms while running or jogging, if you feel very out of breath or you have any sort of any complaints, then I think then you can just consult your family physician or anything if there is any. I don't think there will be any issue in that. And I hope you are not overweight.
No, just little overweight, not very overweight.
That's okay. You can start with the run jog, just walk and jog, and gradually you can take the guidance of some coach or physical trainer, and I think you can go ahead.
For the 16th, I've opted for 10 kilometers.
10 kilometer, I think, will be too much if you have not done any running and you have just recently started. You should target 5 kilometer first rather than going for 10K directly.
Got it.
We've got 10 minutes left. So Saurabh, quickly, if you could ask the next question, because there's Satish who wants to ask after.
Sure. Hi. Thank you, Doctor. Thanks for the opportunity, ma'am. Doctor, I have been a part of a structured training program, and I run the full marathon, which is 42 kilometers. And I do it in fairly reasonable time, under 4 hours at the moment. The issue that I have, so obviously I'm used to hydration, I'm used to having gels, etc. during the run. But what I keep observing and what is consistent in all this is during the run, I have swelling in my palms, both the hands, and in my feet as well. So no matter how much hydration I have, obviously I have fasten up, I have reload, gels at appropriate intervals as we are trained to, but then this swelling in my hands and in my legs does not seem to go away.
It persists for how long?
So doctor, this continues for about say half an hour, 40 minutes after the run. So I again have my hydration back. I have coconut water, etc. to replenish the electrolytes. I have my recovery food, and then it becomes normal. So there's no discomfort, etc. that way. But while I run, all of this swell up. So it causes a bit of scare. And during the run, my heart rate moves up to almost 190, 200 at times as well.
How much? How much?
Almost 190 to 200. So I run at a pace of
then I think you are, if your heart rate is going up to 190 and 200, you are overdoing it. You should not let your heart rate go beyond, your maximum heart rate.
Okay.
So which will be somewhere between 220 minus your age will be the maximum heart rate. Try to be under, 90% of your maximum heart rate. If your heart rate is going beyond 190, 200, you should try and slow down.
Okay.
Or maybe you're training, or maybe you're not trained for that pace, or maybe you need some more training for for that pace, or maybe you then there are other factors like if you are running in summers, your core temperature tend to rise, your body get dehydrated. That also can lead to such shooting in the heart rate.
Okay.
Maybe you are not. Sorry.
Sorry. And what about the swelling, doctor? Is there any particular reason that you attribute?
No, I don't think there should be any reason. Yes, swelling in the feet can happen when you are doing, running, but that is temporary. It will go in a day or so. I don't think there is anything to worry about.
Okay. Fair enough. Okay. Thank you.
Okay, Satish, you could ask the next question quickly. Satish, can you hear me? Oh.
Satish, you are on mute.
You have to unmute yourself, Satish.
हाँ मैम, नमस्ते मैम।
नमस्ते।
हाँ, मैं 63 इयर्स एज है मेरी और 71 kg वेट है अप्रोक्सीमेटली। मैम मैं डेली 5-6 किलोमीटर डेली रन करता हूँ और पिछले 3-4 महीने से लॉन्ग रन की प्रैक्टिस कर रहा हूँ। तो मैंने 15, 17, 18 किलोमीटर भी रन किया है। आज जब मैं सवेरे दौड़ रहा था तो मैं अमूमन जब लॉन्ग रन फिनिश होती है तो मैं 200 मीटर जो लास्ट फिनिशिंग होता है उस वक्त मैं लंबा स्टेप लेके स्प्रिंट लगाता हूँ। तो आज जब मैं सुबह लगा रहा था फिनिशिंग पॉइंट से पहले तो अप्रोक्सीमेट 5 किलोमीटर गया था, तो मेरे लेफ्ट लेग की जो पिंडली है वहाँ पे थोड़ा सा स्ट्रेन हुआ है हल्का सा। बाकी मैं डिहाइड्रेशन वगैरह ये सब चीजें करता रहता हूँ। वो क्यों हो गया?
वो तो देखो आपके मसल स्प्रेन वगैरह आ ही सकते हैं अगर आप लॉन्ग रन कर रहे हैं और आप यूज्ड टू नहीं है। तो आई थिंक आप उसको ग्रेजुअली इंक्रीज करिए, सडनली 10 किलोमीटर से 18 किलोमीटर पे मत जाइए, 10 से आप पहले 14 करिए, फिर 18 करिए, इस तरीके से।
हाँ, मैं वैसे चल रहा है मेरा 8 किलोमीटर।
और इट इज वेरी इंपॉर्टेंट व्हेन यू स्टार्ट योर रन, ट्राई टू डू, it should, your run should always be, you should always start with a warm up and end your run and with a cool down, so these two
हाँ,
are
वो सब,
very important.
हाँ वो मैं रन स्टार्ट से पहले ही एक्सरसाइज वगैरह करके वार्म अप होके उसके बाद कूल डाउन भी करता हूँ। फर्स्ट टाइम हुआ है। वैसे मैं 10, 12, 15 मैक्सिमम 18 किलोमीटर तक गया हूँ, और मैंने अभी 4 सितंबर को।
ये तो क्वाइट पॉसिबल है कि जैसे आप रन कर रहे हैं या कई बार मसल में स्प्रेन आ जाता है कई बार, तो वो सब चीज़ें तो मतलब होती हैं, तो आप अच्छे से स्ट्रेचिंग करिए, अपना रिकवर करिए, अच्छे से फ्लूइड वगैरह लीजिए, आई थिंक वो चला जाएगा।
ठीक है, थैंक यू।
Thank you, Satish. Baljit, if you can ask quickly, and Dr. Ramit, I may not get the chance to say thank you because we'll probably be disconnected.
No problem.
Please,
Thanks.
Baljit, carry on, yeah.
हाँ जी, सत श्री अकाल साਰਿਆਂ ਨੂੰ जी। सर मेरा क्वेश्चन है कि लास्ट 5 मंथ्स तो मैनू मेरी ਜਿਹੜੀ ਸ਼ੂਗਰ ਲੈਵਲ ਆ ਉਹ ਥੋੜੀ ਅਪ ਹੋ ਰਹੀ ਆ, ਕਿਉਂਕਿ ਮੈਂ ਇੱਕ ਸਪੋਰਟਸ ਐਕਟੀਵਿਟੀ ਕਰਦਾ, ਮੇਰੀ ਡਾਈਟ ਵੀ ਮੈਂ ਆਪਣੀ ਬੜੀ ਬੈਲੈਂਸ ਰੱਖਦਾ, ਇੱਕ ਹੈਲਥ ਦੇ ਨਾਲ ਹੈਲਥ ਦੇ ਵਿੱਚ ਮੈਂ ਹੈਲਥ ਡਿਪਾਰਟਮੈਂਟ ਦੇ ਹੋਣ ਕਰਕੇ ਮੈਂ ਆਪਣੀ ਜਿਹੜੀ ਡਾਈਟ ਆ ਉਹ ਬਿਲਕੁਲ ਕੰਟਰੋਲ ਰੱਖਦਾ, ਸ਼ੂਗਰ ਅਕੋਰਡਿੰਗ ਵੀ। ਤਾਂ ਇਹਦਾ ਰੀਜ਼ਨ ਇਹਦੇ ਅਕੋਰਡਿੰਗ ਟੂ ਮੇਰੇ ਕੁਝ पेन्स भी होन, क्राइम्स जिसमें आप कह देते हैं, क्राइम टाइप।
आप डायबिटिक हैं क्या?
नहीं, नो, नेवर नेवर सर, नेवर।
तो क्या बता रहे हैं, आपका शुगर बढ़ जाता है?
हाँ, शुगर मेरा पिछले 5 मंथ तो ना, पिछले लास्ट 5 मंथ तो ना मेरा शुगर ਲੈਵਲ ਦਾ ਥੋੜਾ ਜਿਹਾ ਸ਼ੂਗਰ ਲੈਵਲ ਅਪ ਹੋ ਰਿਹਾ ਵਾ। ਜਿਵੇਂ ਕਿ ਮੈਂ ਫਾਸਟਿੰਗ ਤੇ ਕਰਦਾ ਤਾਂ ਮੇਰਾ ਸ਼ੂਗਰ ਲੈਵਲ 130 ਤੋਂ ਲੈ ਕੇ 150 ਤੱਕ ਹੁੰਦਾ ਵਾ। ਤੇ ਜਦੋਂ मैं
ये तो आप बेसिकली डायबिटीज उसमें आ जाते हैं। आप अपना HbA1c वगैरह करवाएं, एक बार अपने फिजिशियन से कंसल्ट करें, और मुझे लगता है कि आप एटलीस्ट एक बार तो अपना प्रॉपर स्क्रीनिंग जरूर करवाएं, जिसमें आपका एक ECG होना चाहिए, कोलेस्ट्रॉल होना चाहिए, आपका आपकी एज, आपको डायबिटीज आ रहा है तो आपको एक बार अपना स्ट्रेस इकोकार्डियोग्राफी जरूर करवाना चाहिए। और मतलब इन सब चीज़ों से एटलीस्ट ये क्लियर हो जाएगा कि आपका बेसलाइन प्रोफाइल क्या है, उसके अकॉर्डिंगली यू कैन गेट द गाइडेंस फ्रॉम योर फिजिशियन और कार्डियोलॉजिस्ट।
हाँ जी, ਇਹਦੇ ਵਿੱਚ ਮੇਰਾ ਨਾ ਵਿਟਾमिन डी काफी मेरा लो सी, वो भी मेरा
वो हम पूरे इंडियंस में हमारा विटामिन डी काफी लो रहता है, तो हमें आई थिंक हफ्ते का मतलब स्टार्टिंग में जैसे 1-2 महीना हमें हर हफ्ते एक बार तो विटामिन डी ले लेना चाहिए। उसके बाद मेंटेनेंस के लिए हमें महीने में 1 या 2 विटामिन डी के सैशे एक कप ऑफ मिल्क के साथ जरूर लेना चाहिए। स्पेशली जब हम रन कर रहे हैं तो हमें अपने विटामिन का ध्यान रखना जरूरी है।
ओके सर, थैंक यू जी, थैंक यू मैम, थैंक यू जी, इसकी अच्छा मीटिंग लगी।
तो मुझे लगता है कि जो भी 35 इयर्स बियॉन्ड है, 40 इयर्स बियॉन्ड है, रिसेंटली स्टार्ट किए हैं, तो दे ऑल शुड गेट देमसेल्फ चेक्ड। एक बेसलाइन ब्लड प्रोफाइल उनका ज़रूर होना चाहिए, जिसमें उनके कोलेस्ट्रॉल्स, और दूसरा अगर उनके फैमिली हिस्ट्री में स्ट्रॉन्ग फैमिली, पॉजिटिव फैमिली हिस्ट्री है हार्ट डिजीज़ की, मतलब अगर उनकी फैमिली में किसी को लेस देन 50 इयर्स में हार्ट डिजीज़ हुआ है, then they have a high, they come into the high risk category, so they should get themselves cleared from their cardiologist by either doing a normal non-invasive testing like a stress test, ECG, echocardiogram, just to make sure that they don't have any coronary artery disease, because sometimes you don't get any symptoms, but I have seen 2-3 patients I have detected, they were absolutely healthy, they were having no symptoms, but while doing stress tests, their stress test came out to be positive, and one person had 3 vessel disease, he underwent angioplasty, and he was absolutely healthy doing gymming, 5-kilometer running. So you don't know what's there going on inside. Once in 2 years at least one should get themselves thoroughly checked. हमारे सब हॉस्पिटल्स में प्रिवेंटिव हेल्थ चेकअप्स हैं, तो आई थिंक वी शुड गेट आवरसेल्फ स्क्रीन at least once in 2 years, since we are a lot of us are doing high intensity workout, so we should all take care. अगर हम इतना भी ध्यान रख लें, अपनी स्क्रीनिंग प्रॉपरली 2 साल में एक बार या 1 साल में एक बार हम करवा लें, तो उससे भी हम काफी सारे इंसिडेंसेस को कम कर सकते हैं।
जितिन जल्दी से पूछ ले यार, जितिन, क्विक जितिन, you have to unmute.
Yeah, hi, good evening, everyone. Just my question was, अभी डॉक्टर साहब ने वैसे ही डॉक्टर रमित ने काफी अच्छा एक्सप्लेन कर दिया कि above 35 that we should get a screening done at least once or maybe twice in a year, once in 2 years. But what basic screening, you know, जो भी कोई नया बंदा होता है कि अगर वो सोचता है कि मैं अपनी screening कराऊं, so what basic
तो
screening
उसमें
that should be
बेसिक
done?
पैरामीटर्स आ जाते हैं, जैसे आपका ब्लड शुगर आ गया, सीबीसी आ गया, किडनी फंक्शन, रीनल फंक्शन, लिपिड प्रोफाइल, थायराइड का टेस्ट हो गया, है ना, एक ईसीजी हो गया, बेसिक इको हो गया टू रूल आउट एनी स्ट्रक्चरल हार्ट डिफेक्ट। अगर किसी को फैमिली हिस्ट्री में हार्ट डिजीज का इशू है, किसी को ब्लॉकेजेस वगैरह का इशू है, तो वो एक स्ट्रेस